This Spotlight on Long-Term Care is sponsored by Standard Life and Accident Insurance Company, serving the insurance needs of seniors for more than 50 years. For more information, visit slaico.com. Sales in life insurance policies offering long-term care benefits soared in 2010, with women buying the majority of the policies, according to the American Association for Long-Term Care Insurance. Sales of the life insurance plus long-term care policies rose 79% among the industry's top insurers, and 60% of new buyers were women. The life insurance policies allow policyholders to access funds to finance long-term care needs. According to Jesse Sloan, AALTCI's executive director, quote, "Consumers are finding these products offer a significant advantage when it comes to long-term care planning. For those with sufficient savings to purchase coverage, these new forms of protection help overcome the what if I don't need long-term care," unquote. More than one-third of women who purchased the Life Plus LTC policies in 2010 were between ages 55 and 64, according to AALTCI. Nearly 40% were between ages 65 and 74. More than two-thirds of the new policies purchased in 2010 had a single premium face amount of $100,000 or more, and 1/4 of policies purchased had a face amount of more than $200,000. The Department of Health and Human Services will issue a rule amending the Community Living Assistance Services and Support or CLASS program, according to Kathy Greenlee, U.S. Assistant Secretary of Aging. Greenlee said that changes in the rule could include increasing the minimum earnings requirement for enrollees, indexing the premiums for inflation, and increasing anti-fraud protections. Under the Affordable Care Act, CLASS is required to sustain itself through premiums without federal taxes. The program's sustainability has recently been questioned by members of Congress and President Obama. HHS Secretary Kathleen Sebelius is required to discuss changes to the program before October 1st, 2012. She has said she will not launch CLASS until it is modeled to be financially solvent for a minimum of 75 years. Nearly 60% of Americans are opposed to changes to the federal state Medicaid program for those with lower incomes, according to a Kaiser Family Foundation survey. As part of the 2012 budget approved by House Republicans last month, Medicaid would be converted to a federal block grant program, which would provide states with fixed amounts of money and then allow them to set appropriate coverage. The Kaiser survey found that 79% of Democrats and 29% of Republicans favored keeping Medicaid in its current form. Republicans state that changes to Medicaid would help reduce federal spending by $1 trillion over the next decade, but Democrats say such cuts would leave many elderly Americans without insurance, Kaiser said. Support for Medicaid often hinged on whether those surveyed knew someone that currently receives Medicaid, according to the survey. For more industry spotlights, visit producersweb.com.